So much. First and foremost, if you can give us, background and a bit of context, and more details about the SA-Cuban agreement under which these doctors are employed, and what specific skills or specializations do these Cuban doctors bring that are perceived as lacking among local doctors?
Well, it's part of the broader Cuban doctor training program, which is very extensive, and might I say very expensive as well. I asked a previous question in the Gauteng legislature about how much it costs to train doctors in Cuba. It was more than double what it costs to train locally. And remember, you have to spend a year in Cuba learning Spanish, and then even when they come back to South Africa, they have to spend 2 more years at a medical school to finish their training. So that's part of the agreement. The other part of the agreement is employing Cuban doctors locally, which makes no sense when we've got South African doctors employed who can do the same job. So the question I have been asking over the years is how many Cuban doctors have been employed. The current figure is 11 Cuban doctors. It's costing 40 million rand a year. Those are 11 jobs that local South African doctors could fill, and they're all in urban areas. Several in Johannesburg. There's one at Tembisa Hospital. There's one at Telemugurani Hospital in Vosloorus. There's in Kuruleni. They're very available jobs for people in Gauteng, who I'm sure would very much want to fill these jobs, but they're currently filled with Cuban foreign doctors, and there doesn't seem to be a plan to terminate their contracts.
Mm, mm. And early this year, you had newly graduated South African doctors who are unemployed. All of them saying that we need jobs. And I think the main concern that the department highlighted was the issue of a budget. That there might not be any money in the fiscus to be able to give these doctors jobs and to be able to pay them. I want us to take a look at a bit on the cost analysis. How do the salaries of the Cuban doctors compare to what would typically be paid to a South African doctor with similar qualifications and experience?
Well, from what I can see, they're getting the rate for the job. So it's the normal rate for the job from what I can see. I want to ask some extra questions on this. What they're being paid is between 1.2 and 1.6 million rand. But these are all jobs that should be performed by South African doctors. Now, there's over 200 community service doctors that still haven't been placed. There's probably about 1,000 unemployed local South African doctors. And meanwhile, there's actually vacancies. 14% of medical positions in the South African public health system are vacant, and there are people who are willing to fill them. Government says they don't have the budget. Well, I can tell you that there is the budget. It's just very badly spent. Gauteng Health budget is 62 billion rand. It's an enormous amount of money, just very badly spent. There's massive corruption, looting, just plain old stealing. That's really what's happening. We saw with the corruption at the Tembisa Hospital alone, 1 billion rand that was misspent. Well, imagine if that money was properly spent on filling all the vacancies. It's not just doctor vacancies. We've got nurse vacancies and other vacancies. We just have a very, very poorly run health system. If we the entire budget properly, I'm sure we could fill those medical vacancies. And certainly we shouldn't be training local doctors at great expense, so then they can't get a job. And many of them emigrate or have to find other options, or unfortunately, they're sitting at home unemployed.
Jack, with a situation like this where you have, foreign professionals coming into the country, you'd obviously expect to be some kind of a skills transfer, so that when they do decide to leave, and go back to their countries of origin, we're left with those skill sets here at home. as someone who's in the corridors of the health sector, particularly in the province, are we seeing that? Are we seeing a skills transfer between the Cuban doctors who are paid very handsomely by the South African government? Are we seeing the skill transfer to our local doctors here at home, so that when they do decide to leave, we're not forced to continue paying them whatever they essentially demand, because, well, we can't do the work that they supposedly can.
Well, no, I don't think we're seeing that, because, in fact, we've got all the specialist skills that we need in South Africa. We have world-rated medical schools that still are highly regarded, and very good people who could provide that. Now, the proof of the pudding is that the fact of the matter is that when our student doctors come back from Cuba, they still have to finish off at a local medical school. So if it was so good there, why do we have to finish the job? And that's the whole thing. We also have very different medical circumstances to Cuba, a different country entirely, different health challenges. So, I mean, I don't see what are actually gaining from this agreement. It just doesn't make sense. And if I might say, there's been lots of scandals associated with the Cuban medical agreement. I think money's gone missing, and it's extremely expensive. Can I also say that the Western Cape Health Department, which is acknowledged to be the best run health department in the country, the Auditor General gives it clean audits, has opted out of the Cuba agreement. So they spend the money more effectively on local training and employing local doctors. If the DA takes over the Gauteng provincial government, we will withdraw from these Cuba training programs and certainly cancel these contracts with Cuban doctors as soon as possible.
I'm not sure how long this treaty that we have, this healthcare treaty, exchange of doctors, their doctors coming to our side of the country, and some of our doctors being trained in Cuba. I'm not sure how long it has been in place, the treaty. But from your understanding, how effective has it been? This health treaty that we have with Cuba and the exchange of doctors and medical knowledge across the two countries.
Look, the better justification for it is if we could find if it would assist to place doctors in rural areas. Now, Gauteng is just largely one big urban area, so it really doesn't fit Gauteng. But even in the case of doctors for rural areas, we should be making conditions attractive for doctors in rural areas. They go to a clinic, very far away. They don't have amenities, and they work under terrible conditions. They don't have the equipment, and who wants to work in such conditions where you can't do the best for your patients? That's, I think, a major reason why we can't get doctors to rural areas. Just poor infrastructure and poor incentives. So the money that we are spending, a considerable amount of money on this Cuban program, I think could go to upgrading rural facilities. And also there can be an emphasis on selection when one does for local medical schools and people who prepared and committed to work in rural areas. So that's a problem that can be solved. I don't see why we have to have this very expensive and badly run agreement with Cuba. It's been operating for more than 20 years. It's just makes no sense to continue to do that. Provinces can opt out of it, and Gauteng under the DA would opt out of it and use the money more effectively.
Mm-hmm. The issue of foreigners working in South Africa, no matter in what sector, is always a contentious one. Sometimes you'd have words like xenophobia being thrown around. Is there a risk that the stance that the Democratic Alliance hold could be viewed as xenophobic, and how do you plan to manage the public's perception regarding this issue?
Well, we're talking about a specific agreement with Cuba, which we actually think is very poor value for money and very badly run, and that's a very specific thing. On the issue of foreign skills, well, if the country doesn't have it, then it does make sense in our own interest to import foreign skills and have skills transfer to take place. and that's a net positive for the country as a whole. We all want economic growth. But the current problem actually is that Home Affairs is very slow in approving these visas for skilled people that we actually need to grow the economy. The current Cuban doctors are here on what's called a treaty visa, but I don't think they add particular value to the country. The particular skills that we need to assess and make a plan to get them. But this particular program, I don't think, is giving that.
And just lastly, before I let you go, Jack, two last questions. What recourse is there, to make sure that South African doctors, young people that go through a very rigorous education system process for 7-8 years are finally given a chance to serve their country, because a lot of them are at home in their thousands. What recourse is there? What can be done to make sure that with our ailing health system, specifically in the province of Gauteng, that's one of the most populated provinces in the country, you have doctors in our hospitals, and the people of the province and the country essentially are given the rightful right of free quality healthcare.
Well, I think it needs a different provincial government, to be honest. I've been in Gauteng legislature since 1994. I've seen so many promises to fix up the Gauteng Health Department. It's not going to happen under the ANC, I'm afraid to say. And we have elections coming up, and if there's a different government leading Gauteng, we can make it like the Western Cape. DA has proven that we can govern, and the Western Cape Health Department is a model for the Gauteng Health Department to follow, and that's what we'll do. So that's the recourse in the immediate future, because I think there needs political change.
And lastly, again, before I let you go, I think there was a scandal that rocked the province of Gauteng. I think it was a month ago, about the issue of Gauteng public hospitals in what one would call a communication crisis with the phone bills that were unpaid. How far are we with that? Have the bills been paid? Is there swift communication happening in the Gauteng Health Department?
Well, I pressured the department over many weeks about this, and it turned out that they hadn't been paying their bills, and eventually they have paid their bills. A week ago, they were saying that it was only the Carltonville Hospital that the phones weren't working, but this is a scandal that never should have happened in the first place. It's just symptomatic. In fact, the Gauteng Health Department doesn't pay its bills. They don't run their hospitals properly. People suffer. Their priorities are misplaced. And I think that we need political change to do what we need to fix up the Gauteng Health Department.
All right. Thank you so much, Jack. I'm going to let you go, and really, really appreciate you giving us your time.
Thank you.
There you have it there. The DA Shadow Minister of Health, Jack Bloom, there, just giving us insight on, this treaty that the South African government has with the Cuban government to have a transfer of doctors, to have a transfer of, health workers, essentially between the two countries. And the Gauteng Health investing millions annually in Cuban doctors to address, our health care needs, while you have South Africans, young South Africans who've went through, a rigorous education, system, through our very top universities, I should mention, here in South Africa, that are lauded worldwide, for just how brilliant they are, but they can't get jobs. They're sitting at home, doctors. But you have Cuban doctors coming in, working, being paid handsomely by, our government. Whilst when you ask about, the South African young doctors that are unemployed, you are told there's no budget. Really, really concerning stuff there. We're going to take a quick break. When we come back, we'll be getting the latest on the removal of Voice of the Cape presenter Shafiq Sadiq, following a viral photo suggesting that he attended an Eid al-Fitr lunch with Cape Town's DA Mayor Jordan Hill Lewis. More on this after the break.